So I'll have you start off telling me like who you are and what you do.
Okay, so my name is Brandon. I am a dance instructor. I'm also an artist, also a videographer and photographer. I'm currently 33 years old. I've been dancing for the past 15 years, and that's just a little bit about who I am.
Gotcha. And then what styles of dance are you involved in?
I primarily focus on hip hop, breaking, and house. Also, New Style Hustle, which is a social dance. So, yeah.
Nice. So what's your experience with injuries as a dancer?
Unfortunately, they're my friend. I'm very, very familiar with injuries. It's been happening literally since week one of me getting into dance. Like, my first style of dance was breaking. So, because I didn't have a teacher, I didn't take classes, I kind of just dove into the dance through a school club. There was lots of injuries that were present, unfortunately. But, I think that kind of taught me how to not do certain things. So I use like my painful experience to then pass on like positive information to my students on like how not to do certain things just because I went through the hardship of like learning literally the hard way. So yeah.
And then tell me your experience with just like healthcare in general.
Another rocky road. I feel like during my experiences going to see doctors and visiting hospitals due to injury, I never really felt that I was heard. I never really felt that my injuries and what I was going through was truly understood. I kind of just felt like a lot of the doctors were kind of just like, oh, well, you're a dancer, okay, cool, take these meds. And, just like we're gonna like have you go to this PT and just follow up with them for like about a month and you should be fine, and that didn't really solve anything. I felt it was kind of just slapping a band-aid onto something that needed like full attention, and things never really got better. I just learned how to tolerate a lot of my injuries, and to this day some of them are still kind of like affecting me, so that's where I'm at with that.
And if you could give advice to new or old generation, the older generation of like physicians, doctors, PTs, what would it be? Like what advice could you give to them to provide better care to dancers?
um for starters, I think that it would help if you genuinely just took the time to really understand like how we got injured and what we're doing. I think I don't necessarily know if doctors truly understand what it is that we're actually up to. And I think that maybe the best way to approach it would be to give us the same type of treatment that you would give to like sports athletes. Because I think maybe if I took that route and I was just like, yeah, like if I'm playing football and I got injured doing this, maybe there could have been more attention that way. Because I've noticed that there is a different dynamic between the amount of attention that athletes get, in the sports space versus what dancers get, because we're more in the creative space, but we're both very, very physical, if not, to the same level or more in comparison to what sport and what dance you're doing. With me being a breaker, like I'm literally using every part of my body, so I think just having a better understanding of the movement that we're doing would be like a great first start. Um, and that could just be something as simple as like doctors even just like watching footage, and just seeing like what it is that we're actually doing instead of them kind of just thinking about it. um, and I don't know, I just want to actually just feel like that connection between me and whoever it is that I'm talking to, that they have like that level of empathy, and I'm not just like a number and like, okay, all right, and then all right, go on your way, just having like that basic human to human connection. And I've only experienced that with like one of my doctors, and that was something that wasn't even related to like injury. That was something, you know, due to cardiovascular issues. But that's a whole nother thing. But yeah.
And what are some barriers for you when it comes to getting like healthcare? Like what are things that would stop you from going to a doctor?
I think what type of insurance they accept, that's just, I think, the given. Because I freelance because I'm technically like self-employed, I think this creates a very, very difficult situation for many people like myself, where, you know, we need to figure out, okay, are we gonna go to the hospital or not? And if we do go to the hospital, we're literally thinking about this crazy like expense, where I think that shouldn't be an issue. I think it's really sad that there's been a couple incidents that happened, you know, in my dance career, where I told friends, do not like call 911 because I'm worried about the bill. I think that's ridiculous. And then when I have to explain these stories to some of my friends that are not from here, from other countries, like they feel really bad for us because they get taken care of in other countries the same way that any other, you know, person would, regardless of like their occupation. So yeah, I think that, again, just to reiterate the question, I think that healthcare is probably like the biggest thing, and making sure that dancers are able to be seen and not necessarily like worrying about like, okay, like can I afford this, you know, because a lot of dancers are like sitting at home with injury because like it's gonna hurt their pocket. So yeah.
Yeah, I definitely connect on that level because like even now as a PT and I earn a salary, I still struggle to go to a doctor's because it costs so much. My copay is like insane.
Yeah.
So it definitely stops me. What do you think are ways, or so growing up just like in hip hop myself too, b-boying, like we're not exactly a community that has like a lot of money like ballet or the resources that like a lot of like contemporary and all these more like I guess socioeconomically or like structurally historically more wealthy dance styles have. So what would you like to see, or what are ways you think that healthcare professionals can help communities in these dance, like I guess help these dance communities like in hip hop or like breaking and etc.
I think for starters, creating awareness that there are facilities where dancers are able to go regardless of like what their pay is. I think as long as, I don't know, you're able to kind of like prove that, you know, like you're working within the dance space, like just something, and being able to communicate the trust and create like a healthy dynamic between dancers and somebody that is willing to treat you, I think is very, very important. Like the way that you approached me, for example, like I felt safe, I felt heard, I felt like you could be trusted, and it definitely helped that you were also part of the community as well. So it's not like, you know, you're just a stranger. You know, I think that creating that bond, is essential, you know, for any type of like care. Whether if it's physical health, whether if it's mental health, making sure that whoever is trying to provide help can gain the trust of the people that they're trying to help. And I think also if more people that are willing to help are continuously going to spaces where they know that dancers will be, just so that people know that they exist again, I think that would be helpful. So this means popping up at different dance events and maybe collaborating, you know, with the organizers to have like a small setup just like this, you know, where they can talk, hand out pamphlets, or even just get like a small, you know, I don't like consultation, or just creating awareness, I think, is just what I'm trying to say ultimately. So, yeah.